So, Paula, do you want me to start now or you wait until 3:05? I'm happy to go either way. I think, Paulette, you're speaking, but you're muted.
Oh, thank you. Does anyone have questions about some of the content that was shared this morning? I know some people came up, had some questions about COVID vaccine, but any thoughts or questions before we get started on hypertension and or high blood pressure? Yeah, okay. I know one question that someone raises that why are kids having high blood pressure at such young ages now? Like,
I think I would love to answer that at the end of the presentation
okay, okay,
because we're gonna look at a lot of the contributors to high
excellent.
blood pressure, and I think it will become obvious that with some of our dietary patterns and lifestyles that are changing, it's not just. I mean, I would say what we are seeing. It's not just with kids getting high blood pressure at younger ages, but particularly we see what historically has been called adult onset diabetes now
Mhm.
evident in kids under the age of 10 sometimes.
Yes.
So the dramatic changes in lifestyle that is leading to risk factors. One of my colleagues published a paper in the New England Journal of Medicine just a couple of years ago, looking at the current rates of obesity in children age 2
Yes.
through 18, and they are predicting that by age 35, 57% of children age 2 of young people, I should say this is children and youth age 2 to 18 today will be obese at age 35. 57%. And among African Americans and Latinos, it's 67%. So,
Mm.
I mean, just the dramatic increases in obesity among very young children are putting them at risk for a broad range of chronic diseases, with hypertension being one of them, but diabetes being another one, and so forth. All right, so I will just go ahead and get started. Um,
Yes, please do.
and I have a lot of material to cover, but I hope we'll have time for questions. How you can cure, in quotation marks, manage might be the more appropriate technical term, blood pressure in 6 weeks. So, first, just some data to put this into context about blood pressure. One in every three adults have hypertension, and only half of the persons with hypertension have their blood pressure under control. And blood pressure that is not under control puts individuals at a higher risk for a broad range of other conditions, with maybe stroke being the most prominent of them. In addition to the fact that one in every three adults have hypertension, an additional one in every three adults have prehypertension. That means that although you are technically in the normal range, but you are at a high end of the normal range and likely to progress to hypertension. One of the things we need to realize with, take systolic blood pressure, for example, although there is a cut point at which, generally, if your systolic is higher than 140, we say you are hypertensive. But the relationship between systolic blood pressure and a broad range of cardiovascular outcomes is a continuous relationship. So, what I mean by that, technically, if your blood pressure is 135, systolic blood pressure is 135, you're not hypertensive, but you are at much higher risk than if your blood pressure was systolic was 115 or 120. So the higher it is, even within the normal range, is the higher the risk. And high blood pressure raises the risk of strokes, heart attacks, kidney disease, and more. So I want to talk to you about the diet. This is the diet that is remarkable that has shown the success. This is not new. The evidence of this has been out there for a while. It's just that it's not being embraced and practiced, but the science behind it is very good. It comes from a 1997 study. 1997. So this is not new information. And by the way, the evidence that this diet works well is been recommended by multiple prestigious organizations that are interested in the health of the American population. So the diet I'm talking about today, the DASH diet, is recommended by the American Heart Association and the American College of Cardiology. It's a diet that lowers blood pressure as much as drug treatment, regardless of one's age, sex, weight, or race. In fact, if you combine the diet with reductions in salt intake, the DASH diet is actually superior to drug treatment, is what the scientific evidence shows. Superior to the medications that your provider would give you. I'm going to say this multiple times in my presentation. Even though I'm recommending a diet that is good, as effective with salt intake reductions, even better than drug treatment, if you are currently receiving treatment for blood pressure, I would not recommend that even if you embrace this diet 100%, that you stop taking your blood pressure medication. Let your physician tell you when to stop. If you embrace the diet, your blood pressure will be lowered, and your physician will tell you that you can reduce. You certainly have that conversation, but I'm not recommending that you would take it into your own hands to stop taking your blood pressure medication on your own. This is one of my colleagues at the Harvard T.H. Chan School of Public Health, Dr. Frank Sachs, and he is the person who developed the DASH diet. And I think for us, it should be intriguing. This is what he said of how he developed the DASH diet. The idea of DASH was to look at the diets of vegetarians and other people around the world with low blood pressure and create a similar diet that would be acceptable to Americans. So what he is saying is, what the research shows is that a whole foods diet, a diet based on whole foods, a vegetarian diet, foods as they naturally come from nature, is the diet around the world that is associated with a low level of blood pressure. And the DASH diet is an attempt to make a vegetarian diet acceptable to Americans. The foods we found, he said, in populations with low blood pressure were primarily fruits, vegetables, fish, nuts, and whole grains. They add very little meat, sugar-containing beverages, and desserts. So it gives you a preview of where he's going with the DASH diet. So what is the DASH diet? What does it consist of? Well, it really is very similar to the diet God gave Adam and Eve in the beginning. It's of whole grains, and note we're saying whole grains because white bread is based on the wheat grain, but it's not a whole grain. So it would be whole wheat products, for example, and rice is a grain, but brown rice would be a whole grain, for example. Vegetables, legumes, that's peas and beans, fruit, some fish, low-fat dairy foods, limited fats and oils, very few sweets, very little red meat, sugar-containing beverages, and desserts. So that's the basic idea of the diet. This is an example. This is the DASH diet combined with the OmniHeart diet. It's a very similar diet, and they're given an example here of what people would eat on this diet. 4 servings of whole grains per day, and a serving would be a slice of bread, for example, or half a cup of cereal, half a cup of pasta or rice would be an example of a serving. 11 servings of vegetables and fruit. 11 servings of vegetables and fruit. And again, there are some examples of what is a serving: half a cup of cooked vegetables, or half a cup of raw vegetables, a cup of salad greens, a piece of fruit. These are examples of what would be a serving of vegetable and fruit, but you can see it's very heavy on whole grains. We can come back to that later. A lot of people think of grains as fattening, and I would say it now and I'll demonstrate it to you later. Grains are not fattening. What's fattening about grains is the fat we put on grains. And I'll demonstrate that to you later in my presentation. So pasta is not fattening, is the fat in the pat that we put on the pasta is fattening. Bread is not fattening. Fattening is the fat we put on the bread that's fattening. But we'll come back to that. 2 servings per day of legumes and nuts. An example of that is a quarter cup of nuts, or half a cup of cooked beans is an example of a serving, 4 ounces of tofu. Low-fat dairy, 2 servings per day. And you could see what a serving is. Half a cup of milk or yogurt. Oils and fats, only 2 servings a day. That's in fact very low compared to where the average American eats. Fish and poultry or meat, only 1 serving per day, and a serving is quarter cup cooked. So these servings, so it's really he's trying to give a little meat, but he's really essentially giving a vegetarian diet. So this just gives you some concrete detail of what the diet provides. This is an example. This is one of the studies that looked at the DASH diet. This is what happens in terms of the systolic blood pressure of the participants in this study. This is their systolic blood pressure levels. And what is given up here is where the broccoli symbol is, that's the DASH diet, with kind of French fries symbol that is the control group that's not on the diet. But then they vary the salt intake, those who want a high salt intake, a medium salt intake, and a low salt intake. And if you are on the DASH diet with a low salt intake, you can see the difference between this group and being on the high salt intake and on a standard diet is a reduction, a difference of 15 points of systolic blood pressure. So that just gives you an example of how dramatic the impact is. Here is another study that looked across 6 weeks, the DASH diet and heart disease risk. And you could see that just in 6 weeks, on average, there was a 8-point decline in systolic blood pressure for those who were in stage 1 hypertension, a 13-point decline. So you see about those hypertensive, even a bigger decline. The pre-hypertensive group, a 7-point decline. For diastolic, a 4-point decline overall. This is, again, in 6 weeks. Stage 1, 6-point decline. You also, 4-point decline for persons who are pre-hypertension. Their pressure is high, but not quite in the hypertensive range. You also see declines in cholesterol as well. So there are other ripple effects, other risk factors are being improved by the DASH diet. So basically, this is the idea of the diet. Now we want to talk about how do we get there, and how do we reduce, eat a diet richer in fruits and vegetables and whole grains. And especially, I'm first going to talk about how can we reduce sodium in our diet. Now, importantly, this chart is really important from the American Heart Association. It shows that most of the sodium in our diet comes from processed foods and restaurant foods. So most of the salt in our diet is not coming from salt we add to food when we cook or even we sprinkle at a table, although those are things we should take a look at. But 77% of the salt in our diet comes from processed and restaurant foods. The American Heart Association has identified what they call the salty 6. These are the top contributors to sodium in Americans' diets. And they actually have a plan I'll show you in a minute of how to utilize lower sodium versions of these foods. So what are the salty 6? The 6 foods that contribute the most to salt in American diet. Number 1 is breads and rolls. Number 2, cold cuts and cured meats. Number 3, pizza. Number 4, poultry. Number 5, soup. And number 6, sandwiches. So these are the foods that contribute the most to the average American's diet. So these are the salty six. Um, I want to talk about the importance of fruits and vegetables, and the secret that fruits and vegetables hold to salt intake, and importantly to the potassium to sodium ratio. And what we also see here is the brilliance of our Creator. This is an oversimplification, but think of it: there is a civil war at the cell wall in your body. The level of every cell in the body, there's a civil war. When your body has more sodium than potassium, the cell retains water, and that retention of water creates a resistance that leads your blood pressure to increase. However, when there's more potassium than sodium, the body gets rid of sodium and water, and this reduces blood pressure. So, what basically our bodies need is a lot more potassium than sodium every day. So, we need a potassium to sodium ratio that gives us more potassium than sodium. And now let's talk about the brilliance of our Creator. Fruits and vegetables, all fruits and vegetables, as they naturally come from nature, are high in potassium and low in sodium. I want that point to sink in. If you eat fruits and vegetables as they naturally come from nature, they are all much higher in potassium than in sodium. So God has given us the whole foods diet of fruits and vegetables, fruits as they naturally come from nature. By definition, we are on a diet that will keep our blood pressure nice and low. However, the typical modern diet is the exact opposite. As foods are refined, as foods are processed, we reduce the potassium content and we increase the sodium content to preserve the food. I'm going to make this very concrete by showing you some examples in a minute. So, food processing and preservation reduces potassium and adds sodium. In their natural form, plant foods are low sodium foods, naturally have more potassium and sodium, and this higher ratio that we want. However, once foods are changed to other forms, once they are processed, once they're put in a can, sodium is increased, potassium is decreased, and the potassium to sodium ratio is reversed. So what the Creator has given us in foods that naturally come from nature, when mankind touches foods, we see a reversal of that. I want to illustrate that for you so you have a concrete sense of it by looking at several specific foods. Here is an apple, and you could see there's 152 milligrams of potassium to 1 milligram of sodium. That's 150 to 1. That is a food designed to keep your blood pressure nice and low. But look what happens with 100 grams of apple pie. You see the potassium just 80 and the sodium dramatically increase. You see a complete reversal of the ratio where there's a lot more sodium to potassium. Give you another example. Let's look at cabbage. 100 grams of cabbage, and you could see how much has a lot more potassium than sodium. Potassium to sodium ratio very favorable, 12 to 1. But look at sauerkraut, which is cabbage that's processed. You could see the reduction in the potassium content, the dramatic increase in the sodium content, and a complete reversal. Let's look at two more foods so you get the point. But this is true for virtually every food. Look at cucumbers. And you could see more potassium than sodium, dramatically so. 27 milligrams of potassium to every one of sodium. Look at what dill pickles. You see a complete reversal. Decline in potassium, dramatic increase in salt, complete reversal of the potassium to sodium ratio. Let's look at one more example. Kidney beans. This is kidney beans cooked. Again, a lot more potassium than sodium. Kidney beans in a can. Anything in a can I'm not saying you should never eat anything in a can, but just realize anything in a can has a sodium potassium ratio reduced because for preservation of the food in canning, sodium is always in increase and potassium decrease. So here you could see the change of those kidney beans that you cook versus the kidney beans in the can. You see the reversal of the ratio. But the I hope I've illustrated with 4 foods, but this is true of all foods, that anytime they have been touched by humanity in terms of processing and preservation in general, we see these ratios reverse. Okay, 2 more examples. Fresh ground beef. See, more potassium than sodium. McDonald's hamburger, much more sodium than potassium. Tuna in water, more potassium than sodium. Low salt tuna in water, sorry, but the regular tuna in water, you could see more sodium than potassium. All right, take home lessons. Natural foods are changed from low sodium to higher in sodium as they are processed. Natural foods have more potassium than sodium. That is a setup to keep our blood pressure nice and low, but food processing increases sodium, food processing decreases potassium, food processing reverses the healthy potassium to sodium ratio that God designed you should have so that your blood pressure is kept nice and low. So then, how to have a healthy potassium to sodium ratio? That will automatically keep your blood pressure nice and low. Eat more fresh fruits and vegetables. Eat more fresh fruits, eat more fresh vegetables. Frozen vegetables without added butter or sauce are much better than canned goods. For example, limit your use of canned goods wherever possible. Use canned vegetables that are low in sodium if you have to. There are now some brands that have a low sodium option. Look for that if you're shopping. When you have to use canned vegetables or beans, rinse them off to remove some of the sodium. That is one strategy. If you have to use canned goods, if you can rinse off the canned vegetables or beans, that reduces the sodium content. One thing you have to do in order to get on top of this issue of sodium in the food and trying to eat a low sodium diet is to read labels to identify food products that are low in sodium. In general, it's recommended you look for foods with a 5% daily value or less for sodium, and that is on the right on the label. You can see what the daily value for sodium is, and you see here, for example, is this food product. You see the cholesterol content, the sodium 160 milligrams. The daily value is just from this food, you would get about 7% from this one food, 2/3 of a cup of the daily value. So just make a habit of looking at that. If it's more than 5%, you're edging to the high side. So in general, if foods with less than 5% daily value of sodium are better foods to eat. Read food labels. Check packages on fresh meats and poultry to see if salt water or saline has been added. Some brands do, others don't. Look at labels on cheese and dairy. Some are very high in sodium, some are lower, but paying attention to the sodium content. Remember that by law, manufacturers of food have to list the ingredients in a food in descending order. So whatever is listed first is what it has the most of, and then what comes next is the second largest in quantity. So the closer an ingredient is to the start of the list, the more of it is in the food. So that's another little key thing that you can look at. Now, this is important. As you read food labels, there are hidden sources of sodium on labels, so that some manufacturers realize that we're getting a little more sophisticated. And so here are a number of words that are used on food labels to try to disguise the presence of sodium. So it may not explicitly mention salt, But here are other words used like brine and sodium chloride and sodium benzoate and sodium nitrite and sodium bicarbonate and MSG and sodium saturin and sodium. You get the list. There's a lot of other terms that are used that reflect the presence of sodium in the food. Well, what can you do? There are multiple ways in which you can add flavor to your food without adding sodium. Creative use of seasonings can add flavor without adding salt. So, herbs and spices, salt free seasoning blends, chopped vegetables like garlic, onions, and peppers, lemon and lime juice, ginger are just some of the things. This is a little thing from CDC that's encouraging individuals to learn to use more herbs, swap out the salt, and instead shake things up by using herbs and creative use of herb spices and other seasonings to reduce the salt intake, even while you ensure that your food still tastes good. The American Heart Association recommends what they call a sodium swap challenge. That is, they're encouraging Americans to be aware of their sodium intake and to take a 3-week pledge to swap lower sodium versions of at least 2 of the salty 6 items per week. Remember, we talked about the salty 6 items already. And then they're saying you could do in 3 weeks. You look at each of the salty 6 categories, and remember, those are breads and rolls. And so you want to use low sodium versions of breads and rolls. Cold cuts and cured meats is another category high in the salty 6. Pizza, poultry, soup, and sandwiches. So if you pick 2 of them each week, so week 1 you pick 2, you could pick breads and rolls and cold cuts and cured meats, and you said those are the ones you will try to substitute lower sodium foods for that week, and then the next week you add 2 more like pizza and poultry, and the next week you add 2 more like soup and sandwiches. This is just a suggestion, but it's a way they're trying to break the challenge into pieces and make suggestions of what Americans can do to lower their salt intake. Let me talk about the importance of fruits and vegetables. I've talked about its importance in terms of lowering salt intake, but the brilliance of our Creator is that there are so many other benefits beyond reducing salt and increasing potassium if we eat more fruits and vegetables. Here is a study that looked at a large sample of adults in the US. This is a representative sample of over 12,000 adults. And they found a monotonic association between increasing the sodium to potassium ratio and the risk for all-cause mortality, cardiovascular disease mortality, and ischemic heart disease mortality. What that means is that whenever we eat more, every higher level of salt or sodium to potassium is associated with a higher risk of death from all causes as well as from cardiovascular disease. And a low sodium potassium ratio is a marker that we are eating a higher level of plant foods. This is an example of all cause mortality, 46% increase in risk if we are on a high sodium diet. Ischemic heart disease mortality, twice the risk of death from that outcome if we are on a higher salt diet. And I want to tell you, I'm talking about hypertension today, but I just want to show you the United States government, not the General Conference of Seventh-day Adventists, not the Health Ministry's Department of the Conference, but the United States government is saying, if you increase your intake of fruits and vegetables, you are also reducing cancer risk. They have pointed out that 1 in 3 cancer deaths are related to dietary factors, and eating more fruits and vegetables is a good thing. Getting more cruciferous vegetables like broccoli and cauliflower and lycopene-rich foods are all good resources in lowering cancer risks. They're talking about research on the phytochemicals in the fruits and vegetables that play a part. The different colors of fruits and vegetables are really important. All seem to have protective properties in terms of cancer. Here are some examples of the phytochemicals. And you don't need to memorize this or in any way, but it's just to realize that foods as they naturally come from nature are packaged with all kinds of protective resources that science is documenting and documenting the wisdom of the creator in putting Adam and Eve on a vegetarian diet. The government used to recommend 5 servings of fruits and vegetables a day. The National Cancer Institute, which is a federal government agency, is now saying to reduce your risk of cancer, 5 servings of fruits and vegetables a day is not enough. You need 9 servings of fruits and vegetables a day. And this is from their website. They are showing it's not impossible and it's not even as hard as you think to get 9 servings. So they're showing how you can get 2 servings at breakfast with a banana and a 3/4 cup of orange juice. You can get 3 servings at lunch with a salad and an apple, for example, or some other fruit. And then you can get a spinach dish and a potato and a fruit cup. And so this is 9 servings in a day. The point is, it's not impossible. We just have to make up our minds to do it. And you could see this was another resource that the government had recommended years ago, the food pyramid, which said that when you come to eat, the bread, cereal, rice, and pasta group should be the biggest group. As you go up, then fruits and vegetables, and then meat and poultry, and milk and yogurt should be, as you go up, there's less and less, and then you use sparingly fats, oils, and sweets. They have abandoned this. Instead, they have come up with an easier way for you to know if you're doing well in terms of diet. Every time you sit down to eat, half of your plate should be fruits and vegetables. So counting 9 servings and 5 servings is maybe hard, but it's easy. Look at your plate every time you sit down to eat. Is half of your plate fruits and vegetables? If it's not, then you're not getting enough. And then grains, protein, and they recommended dairy. This is choosemyplate.gov. This is a recommendation for the United States government for a healthy diet. My colleagues at the Harvard Chan School of Public Health are not happy with the government's model, so they created their own healthy plate. And there are a couple things that they have changed with it. One is the other one said whole grains, said grains, and they're saying you don't want grains, what you want is whole grains. The other one said you need protein, and they're saying no, you don't want protein, you want healthy protein. So you could see they recommended beans and nuts as good sources of protein, and they are encouraging fish and poultry instead of red meat and cheese, for example, and avoiding the processed meats completely. And instead of dairy, they're recommending water and healthy oils. So again, this is from a research group, this distinguished research group of nutritionists at the Harvard Chan School of Public Health, again making recommendations very similar to what we find in the Bible and the Spirit of Prophecy. This is from the Adventist Health Ministries of the General Conference. This is my healthy vegetarian plate. So they have a version of this plate as well. So let me recap. What are the things we need to do to lower blood pressure? I have heavily emphasized good nutrition, a low-salt diet, and a high-potassium diet combined with a low-fat diet, and that can be achieved by eating foods, especially a diet high in fruits and vegetables as they naturally come from nature. There are other strategies that I want you to be aware of that have also been shown to be successful to additionally contribute to lowering blood pressure. The DASH diet studies are showing just the nutrition alone produces dramatic effects. The DASH diet was not diet and exercise, it was just the diet. So just with a low salt diet and a high fruits and vegetable diet, that alone can have dramatic reductions in blood pressure in 6 weeks. However, if you add to that regular exercise, especially what we would call cardiorespiratory or aerobic exercise, also reduces blood pressure. If you're on a good diet and regular exercise, you will lose weight. Losing weight also reduces blood pressure. Avoiding smoking. Estrogen found in some birth control pills can raise blood pressure. People need to be aware of that. Alcohol can increases blood pressure. It's also important to realize that managing stress, because even if your diet is good and you're exercising, but you are highly stressed and haven't found effective ways to manage your stress, you can still have a hypertension problem. So learning to manage stress and learning the resource we have in Jesus, casting all our care upon him because he cares for us, is really so important. Medications, I repeat again, they do not cure hypertension, but please do not stop taking them if you have been prescribed antihypertensive medication without consulting your physician. Managing your blood pressure and improving health. I want to show you one example of how you can tackle one of the biggest nutrition problems in our modern societies, and that is reducing fat in our diet. If we can reduce fat in our diet, we will not also dramatically reduce the chances of us being overweight, but we are also likely, given the foods that are low in fat, likely to be eating a healthier diet. And I want to give you a concrete example so you'd see it and you'd see how the fat in our diet really makes a big contribution. So here I have a meal: lettuce and tomato salad, a slice of bread, a cup of peas, some kind of entree, could be vegetarian or not. It's about 150 calories. A baked potato, 100 calories. A cup of skim milk, 80 calories. An apple, 70 calories. That's a good bit of food, but that's just 590 calories. That's actually a lot of food for just 590 calories. The problem is we don't eat food this way. So what I'm going to show you is how we normally eat our food. So I'm going to take this meal with a relatively low count of calories for a lot of food here, and we just will add fat to it. So we will add 1 tablespoon of salad dressing, and we've just upped the calories from 20 to 120. We will add some margarine to the slice of bread, and we're not actually using like even a whole tablespoon of margarine, but maybe just half a tablespoon, and you can see what has happened. We'll add some margarine or oil to the peas. Again, a little more than half a tablespoon. We'll add some gravy to the entree. We want some margarine or sour cream or something on the baked potato. Instead of skim milk, we'll take a cup of whole milk, and instead of apple, we'll have one slice of apple pie. Do you see what has happened? We have moved from 590 calories from this meal, more than doubling the total amount of calories just by adding fat. And what I hope you look at the items listed here. I could add mayonnaise here to this list and other things like that we add that are all high in fat. This is where our problem is. Our oils, our margarines, our butter, our fat. I have run into a lot of Adventists who told me they thought that olive oil had less fat than other oils. A tablespoon of oil has 100 calories regardless of what type of oil it is. Now, olive oil may be a healthier oil for you. I think the evidence suggests that, but it has the same amount of calories as any other oil. And so that even if you're using a healthy olive oil, it needs to be used in moderation. So this is the key to reducing fat in your diet right here. It's the dressings, the margarines, the oil, the butter, the mayonnaise, the things, the gravies that we add to food that add fat to our diet powerfully. Before I close and give you a chance for questions, I'm going to give some summary points, but I want to talk about the opportunity for ministry. Here is data from the CDC. You could see of Americans 50 to 64 years old, 61% of all African Americans have hypertension, 41% of all whites have hypertension, but you could see even at very young ages, 12% of African Americans, 10% of whites aged 18 to 34. So my point is, high blood pressure is such a common problem in our society. With the knowledge I have just shared, you can be a medical missionary, you can be an ambassador for good health by sharing with individuals tips that they can use to lower their blood pressure. And I want to show you a study that shows it's not enough just to treat people's problems, but our health ministry is holistic. We're trying to help people change their lifestyle so they do better. So I want to tell you about a study that was published by Len Syme, a professor at University of California, Berkeley, way back in 1978. They took patients that were low income, all of them had hypertension, 80% of them were African American, and they randomly, by a flip of a coin, put them into three groups. Routine care, which is go to your doctor, get hypertensive medication, and sent on your merry way home. Or another group got the routine care plus, went to a class where a health professional taught them about blood pressure. And the third group, they took lay people from the community, trained them with basic information I've just shared with you on blood pressure, but also let those people know what were the resources that existed in the community to help people with problems they would face. And these lay health workers, these are not nurses or doctors or trained health professionals, local people from the community, they made home visits. They had information about blood pressure, but they could also tell people where you could get help if you were looking for a job, if you had financial difficulties, where you could get help. So they provided advice, support, referral, direct assistance as needed. These lay people only had 1 month of training and were sent out to the community. What did the study find? 7 months later, those individuals who got the home visit from a lay person talking about their health challenges and blood pressure, they were more likely to have their blood pressure controlled than patients in the other two groups. They also knew twice as much as blood pressure, although the people teaching them about blood pressure were their neighbors who didn't have any formal medical or public health training. And they were also more compliant. They were taking their blood pressure medication as they should. And among good compliers in this group, blood pressure medication worked twice as good in keeping their blood pressure under control. So everything you want took place with lay people from the community visiting their neighbors, talking to them about blood pressure and about problems people can face. Why isn't every Adventist church training little groups of lay people with basic information about blood pressure and can talk to our co-workers, our fellow students, our neighbors about what they can do to help control blood pressure? Take-home lessons. Nutrition plays a major role, not just in hypertension, but chronic disease. The key principles, if you get all the detail, eat more whole grains. Eat more food as grown. Anytime mankind has packaged it and put it in a can, put it in a package, it's less healthy. Eat more fruits and vegetables. Drastically reduce your intake of fat, salt, and sugar, and focus on making changes for the long term. By that I mean, even if you have to make these changes incrementally, step by step, we are making changes for the long term, not trying to do everything in 1 week. General principles of good nutrition: here are some poor diet habits, heavy evening meals, no or poor breakfast, frequent snacks, excessive intake of empty refined foods. What are good principles of nutrition? Eat a wide variety of foods. Eat foods and not food products. That is, eat foods as they naturally come from nature. Eat the amount necessary to maintain your ideal weight. Eat at regular times. Start each day with a good breakfast. I had a professor of nutrition when I was a student at Loma Linda University. He told us eat breakfast as a king, lunch as a prince, supper as a pauper. So your biggest meal should be your breakfast. And as the day goes on, the meal should get smaller. Plan ahead before grocery shopping and only buy what you need. Why we are saying that? Research finds if you shop, do grocery shopping when you are hungry, you'll buy more stuff and more junk food than if you go grocery shopping when you are satisfied. So again, summary: key to reducing salt intake: eat fresh fruits and vegetables, read labels, pay attention to portion size, Use the salt reduced or no salt versions. Rely less on convenience foods. Avoid salt at the table. Season with herbs and spices. Sorry. Be assertive when eating out, asking questions and asking them to make some adaptations to the menu items. Limit your salted snacks. Limit processed meats. Use small amounts of condiments. And what I'm saying as well, and this is a take home point, improving your blood pressure and your health, new research is pointing to old truths. The Bible said, 2 Chronicles 20:20, believe in the Lord your God, so shall you be established. Believe his prophets, so shall you prosper. The basic information I've given you here is telling you to go back to the diet as close as possible that God gave Adam and Eve in the beginning. I'm sure that you have questions for me, but I hope you have learned a lot about what you can do to control your blood pressure. Questions? I think you can just unmute yourself and ask them.
Or put questions in the chat if you're
Or
not
you can
able
put in
to.
the chat if you prefer that. I can monitor the chat and see if there are any questions there. Any questions or comments?
Doctor, I don't know how to use the chat anyway. So here's my question about LDL. Number one, what again, can you refresh my memory? What's a normal LDL?
The question of what's normal is a challenging one, because oftentimes they define what normal is by looking at the entire population and look at what the average is, and then if you're in a context where the average person doesn't have a good LDL. So I think what would be an optimal LDL, generally what they recommend is an LDL less than 200. But I think to be healthy, it should even be lower than that. But I think what the normal, but that's a range that's out there that is capturing where most Americans are. But if you could have your LDL much lower than that, is what would be ideal. But it's a little dangerous.
Yeah, and they also
Sorry,
and they also classify. I was just going to say they also specify the LDL based on what your other risk factors are. So like if you've already had a heart attack or you have underlying other cardiovascular risks, and they want that LDL less than 70, once you've already had an event.
Yes.
Or so depends.
I agree. So I would say if you would say what's I think prevention oriented folks would say what is a good LDL would be less than 100.
Thank you.
I have a question. Hi, good afternoon, Dr. Williams. Good to see you. Thank you. This is very informative. So the question is there any, some years ago, there were concerns about MSG and so on being cancer inducing. Is that something that is true? That's my first question. So let me just ask that.
I am not aware of any overwhelming scientific evidence that suggests that MSG per se is a major contributor to cancer, on the one hand. On the other hand, MSG is in a lot of processed foods and high sodium. I mean, people who are on a diet of high MSG, the MSG is probably not the only thing they're getting that's unhealthy. So what we know is a diet that reduces your risk of cancer is a diet high in fresh fruits and vegetables. By definition, those products would be low in MSG. So sometimes it's not necessarily the MSG per se, but just that MSG travels in a lane of highly processed foods and foods that have, in addition to, I've heavily focused on sodium, but a lot of processed foods have sugar added to them and fat added to them as well. So that it travels with a lot of other unhealthy foods and that increase your risk for a broad range of chronic conditions.
Okay. Would you remind us, please, of the 6 salty foods that they are saying to avoid? Would you just run through that?
Sure.
Thank
So I will share my screen here quickly so we can go back. I want everybody, it's important to be aware of the salty six. Um, and 1 second here. I'm going to get to it in a second. You could see them here. Bread rolls, full cuts and cured meats, poultry, soup, sandwiches. Those are the salty six. I'll give them to you again here where you could see them even bigger than in that list that I showed you here. So here are the salty six, and these are the foods that contribute the most to the salt intake of the American diet. Bread and rolls, and again, we're not saying don't eat bread and rolls by any means. I am saying to focus on whole grains, but become good at reading labels. Even maybe there may be two brands of cereal of the same kind of cereal, and one is high in sodium than another. So pay attention to labels and try to pick those uh, breads that are and rolls that are low in sodium, but also those that are whole grain. So we want to do two things. We want to get the whole grains in, but we also want to get the low sodium versions of them.
Thank you. There was one more slide that you had there. The general conference had put out a vegetarian plate.
Yes.
Would you put that up again, please? I'd like to
Yes,
take a picture
no
of that.
problem.
Thank you.
I can get that to you in a minute. So this is the vegetarian plate from the general conference. I actually think, to be honest with you, that the plate from my colleagues at the Harvard Chan School is better than this one
Okay.
because because it says grains
Mhm.
and it says proteins, and my colleagues at Harvard, the Department of Nutrition, are saying you don't want protein, you want healthy protein, and you don't want grains, you want whole grains. And instead of dairy, emphasize water. So this is actually even healthier than the GC one, although the GC one is not bad, but this is actually I think a better one.
You know, as Adventists, we sometimes eat these vegetarian substitutes, you know, for meat and so on, which tend to have a high sodium, which tend to have high sodium in them. So what is your suggestion with that? Avoid those veggie
Processed.
meats and so on, those processed foods, you know, the ones that you can get at the ABC and so on.
Sure. So
You-
again,
Mhm.
they're not all uniformly high in sodium. The manufacturers there, by the way, all of those foods were once upon a time owned by the Adventist Food Company. There was Loma Linda Foods, and there was the Worthington Company that was not owned by the church, but owned by Adventist businessmen. And these, if you look at those companies now, Kellogg Company, which actually the Kellogg Company was started by a Seventh-day Adventist, by the brother of Dr. John Harvey Kellogg, Will K. Kellogg. These were Adventists. He had been the business manager of the Adventist, the Battle Creek Sanitarium Hospital, and C.W. Post, from which we got Post Toasties and Postum. He was a patient. So one of the things I'm trying to make the point that many Adventists don't realize, the Adventist Church and early Adventists changed the breakfast habits of Americans. The fact that Americans eat cereal for breakfast
Sure.
was Dr. John Harvey Kellogg's idea to offer an alternative to bacon and eggs for breakfast. And so he started to make cornflakes. And he coined the word granola and made granola. That's where granola came from. Every time you see granola, that was invented by an Adventist, that term. And it was alternatives to bacon and eggs for breakfast. And Postum he made a drink, a malted barley drink, as an alternative to coffee. And there was a patient at a hospital, the Battle Creek Sanitarium Hospital, by the name of C.W. Post. He was fascinated by the stuff he was eating. He went down to the kitchen where they were making these things, and it said he had a photographic memory. He came back to his room and sketched the machinery and equipment that he saw being used to make these products, and then went out into the community. He was not Adventist, and he started a company making Post Toasties. That was not the original name of the product. I think it was Elijah's Manna was the original name, and it caused a furor. But people think he did it as a marketing strategy. He got all the clergy upset. You're desecrating using Elijah's name for your commercial thing, but it caused a huge stir, which is, I think people think he thought that was good marketing, and then he changed the name to Post Toasties, and the drink that he made, he first called it Monk's Brew, and then he changed the name to Postum, which is not as around as much as it used to be, but was very common around. But I'm saying both of those were born out of an Adventist hospital. But Will K. Kellogg, who was the business manager of the sanitarium, got upset with his brother, Will, the physician, saying, "Look at this man. He has taken our ideas. He's out there making money. I'm going to leave the hospital and go open a company to make money as well." And that was how the Kellogg Company was born. So it really came out of an Adventist family. The parents of the Kellogg's were the Adventist couple who sold their prize oxen that started the publishing work. The first publishing house by the Adventist Church was started because of the money the Kellogg the brothers' parents had given to start the work. So I'm just giving you a lot more information than you needed. But I think many people, Adventists I run into, are not aware of the important role early Adventists played in even shaping how Americans eat breakfast. So every time you see
Amazing. Yeah,
cereal products, that's where it came from.
isn't that something? Thank
Yes.
you.
Hello, I'm Dr. Williams. Thank you so much for your talk. My name is Anika, and I'm also a researcher at Duke. I'm a fellow in the Division of Nephrology. And the question I had for you was, how can we be more intentional, those of us in the medical field, also in public health, be more intentional in our work, in our research, in promoting health, knowing, that we have the health message?
That's a really good question. One of the things we can do is to highlight the evidence that exists. For example, depending on your area of work, if it's possible for you to actually study some of these things yourself and study their role in healthier diets, that's certainly another way to get some of this evidence into the scientific literature. Although a lot of times it's not that the evidence is not in the literature, it's just that it's not highlighted. I'll give you a complete example that I haven't spent much time on today, but think of alcohol. Most Americans think that moderate alcohol consumption is good for your health. And there are a lot of studies that suggest there are lower cardiovascular disease risk to moderate alcohol consumption. But those same studies show there's a dose-response relationship between alcohol and breast cancer, for example, and multiple other types of cancer. So there is no protective effect of alcohol in the studies that have been done for some kinds of cancers and a range of other conditions. Most researchers do not know, though, that there have been recent influential studies that have called into question even the findings of the moderate effects of alcohol on cardiovascular disease. That now, if you look at the science suggests that those associations are linked to confounding. Confounding is a scientific problem when there's a relationship between two variables, but it's caused by a different variable. It's not that moderate alcohol consumption is linked to lower rates of heart disease, but people who drink alcohol moderately have other characteristics that predict lower risk of heart disease. And the evidence on that is quite good right now from multiple lines of data. But this is the point. The alcohol industry doesn't want people to know that. They highlight, and they have front agencies, PR agencies that highlight any study that finds an association between moderate alcohol consumption and lower risk of disease. They do not pay attention and certainly don't highlight studies that are problematic. And so most people don't know it. But there are countries such as the British government has said there is, reviewing the evidence, there is no safe level of alcohol use. And that they even, the recommendation they used to make that men should drink can safely drink 2 drinks of alcohol a day, they said there is no safe level. And they suggest as low as possible, no more than 1 at most. But I'm giving an example of where the science is one place, but most even scientists are uninformed because they rely on the popular media coverage that is heavily influenced by commercial interests.
Thank you.
And there's a question in the chat about the blood pressure medications, and are the side effects worse than the medication benefits?
I would let Dr. Chandler help me on that question, but let me begin by saying there's no medication that doesn't have side effects. So there are side effects that come with medications. What we do is a cost-benefit analysis. Having blood pressure, high blood pressure, uncontrolled, can lead to a stroke, and many of these strokes are fatal. So I think if you were to say to me, is it worth it if your blood pressure is high to begin antihypertensive medication to lower blood pressure? Absolutely yes. However, I've just shown you a range of things you can do. That if you do these things and you check in with your provider, let them know what you're doing, your blood pressure will reduce over time. And the evidence suggests even in as little as 6 weeks, we can see dramatic reductions in blood pressure. And your provider will begin probably by reducing the amount of medication you need, and ultimately will make a decision of when you could be taken off of blood pressure completely. But Dr. Chandler, please add in, please.
No, I agree. The damaging effects of not taking the blood pressure medications, meaning the progression of kidney disease, the development of congestive heart failure. And that's what we see, like Blacks develop a lot of what we call diastolic dysfunction, where the heart muscle refuses to relax because of long-standing hypertension that's poorly treated. So if there is a recall, there have been a lot of recalls on these blood pressure medications over the past couple of years. So if there's a recall, yes, you stop taking that. But don't just stop taking any blood pressure medication if your blood pressure is elevated. And of course, embrace these lifestyle strategies that have been laid out today to work with your healthcare provider to lower the blood pressure. But please don't say, I'm not going to take medications because I'm concerned about contaminants, because there are medications that are safe when you're working on these lifestyle strategies to lower the blood pressure.
All right. I see another question in the chat. Patients with diabetes and hypertension seem to have a harder time fighting off COVID-19. Why is that? I will start and then let Dr. Chandler also help me on that question as well. But I'll give you an example of a study done in New York City of 12 hospitals, almost 8,000 patients who were hospitalized for COVID. 92% of all of those hospitalized patients, this is 8,000 patients at 12 different hospitals in New York City early in the pandemic, 92% had at least 2 comorbidities. That is, they were overweight, obesity, hypertension, cancer, heart disease, or other respiratory conditions. 92%. And so yes, you are more, when you have multiple chronic conditions, you're more vulnerable. And there are also specific mechanisms that have been identified, for example, between obesity and being vulnerable, not just to COVID, but that was documented earlier with SARS, for example. But let me let Dr. Chandler, a physician, chime in some more on this.
No, I mean, you've identified even with the comorbidities, what we're seeing with people that are being infected, you know, they're vaccinated, but they're still getting infection and being hospitalized. Those individuals that are being hospitalized with infection in spite of being vaccinated, they usually have underlying comorbidities. So when people say, oh, I'm not going to get the vaccine because it doesn't work, look at these people are getting infected even though they've been vaccinated. You have to understand that when we have underlying comorbidities like obesity, diabetes, there's a suppression of the immune system. It's like this chronic low-grade inflammation that suppresses the immune system. So the immune system is not as effective. And that's why healthy weight is emphasized as one of the cornerstones of the strategy for preventing diabetes, hypertension, but also preventing risk of infection. And of course, we're Christ-centered. We know that Christ is the one that gives us the power to make these choices, and he's the one that controls our body. So we're not saying that, okay, you just do these things and you'll be okay, because Jesus is in control.
Any other questions or comments?
Could you comment on the role of stress and cortisol levels and obesity and high blood pressure, and the role of diet in lowering cortisol levels, or lifestyle strategies in general?
Yeah, I mean, so one of my areas of research is looking at stress, and we find there is a lot of what I would call stress-induced binge eating in our society, that many people in dealing with stress, they turn to food, and comfort foods, which generally tend to be highly processed, high fat, high salt foods, that, like chips, for example, might be an example, but you could go a long list, or high sugar, high fat foods, and so that we turn, I would say many, even some, we turn to food to help us cope with stress, instead of turning to Jesus, who says, "Cast all your cares upon me, because I'm caring for you. Come unto me, all you who labor and are heavy laden, and I will give you rest." There are a broad range of strategies that can be effective in reducing stress. Certainly, one I would recommend is exercise. The benefits of exercise, it is directly expending more calories, so that's a healthy contributor to lower weight, just by getting regular exercise. But there are studies that show that regular exercise is as effective as antidepressive medications in controlling mild depression, not severe depression, but mild depression. So that exercise and getting out in the fresh air, again, we're talking about the 8 laws of health. Ellen White said, go out and exercise every day, even if you have to leave things indoors undone. And that was a message to pastors. She also said, a walk even in winter will do more than all the medicine doctors may prescribe. So I mean, I like to say that Seventh-day Adventists should be the most physically fit people in the world. Why? Because we claim to obey the Ten Commandments, and we claim that we give specific emphasis to this neglected commandment, the fourth commandment. I want you to pay attention to the fact, if you look at the fourth commandment carefully, there are two commands in the fourth commandment. One is, remember the Sabbath day to keep it holy. That's the first command. What is the second command? 6 days shalt thou labor. The Hebrew word for labor is abad. That word is used to describe getting vigorous physical activity, like building a city or plowing a field. That's where the word abad is used. So part of our adherence to keeping the fourth commandment is getting regular exercise. Now, truly, in the time of the children of Israel, they didn't have to do leisure time activity, because they got exercise from their normal activity, and that was probably true for our great-great-grandparents 150 years ago. That you just had to live. People walked a lot more. People didn't have the modern conveniences and all appliances that were powered this way and that. I am not saying we shouldn't use them. I'll give you an example. Years ago, a study was done, and they showed that a woman changing from a manual typewriter to an electronic keyboard, lovely computer keyboard, touched, to the fingers, and did nothing else different, would gain 10 pounds a year just because of the lower level of physical exertion involved with this lovely keyboard, as opposed to the manual typewriter that required a lot more exertion. So that's what would happen to a secretary. But I'm saying that virtually every modern convenience that we have. Think of the remote control. Once upon a time, people would have to change a TV channel, get up, and walk across the room. That was more physical activity. So I'm saying just our modern lifestyle. Think of I remember growing up. The window in your car. You had to turn the window up and turn the window down. You press a button now. That's less physical exertion. I'm not saying there's anything wrong with modern conveniences, but we need to realize the more we rely on them, the less of the abad, the 6 days shalt thou labor, we are not getting. And that's why we need to make a commitment to ensuring that we get physical exercise. So we were talking about things you can do to reduce stress. Certainly, exercise is one. I cannot overemphasize the evidence of sleep. One of these days, Paulette, I can come back and talk about the recent research on
Yes,
sleep. There's
definitely.
been an explosion of research on sleep in the last 20 years. And what I would say to you, just to summarize the evidence, sleep is as important to your health as is good nutrition and good exercise. That's a summary of the evidence. And not getting enough sleep sets us up not for also a weaker immune functioning, but raises our not getting enough sleep is linked to obesity, because we are more likely to eat unhealthy foods, and we actually have experience changes in our brain that makes it more likely that we will not control our appetite. And so that inadequate sleep is linked to so many problems. So getting a good night's rest. And again, we are living in a time where we have all kinds of devices that are beeping all night, trying to keep us awake and keep us informed, and enough entertainment to have us going. So managing stress, taking care of sleep, ensuring adequate sleep is another resource. But the research is also documenting that if you keep a gratitude journal, there are clinicians today in America that are encouraging people to be more thankful. And the research finds if you just keep a daily journal, writing down the things you are thankful for, that reduces your stress and improves your mental health. And good mental health can also contribute. There's a growing body of research to better immune functioning as well. It works both ways. Bad immune functioning also worsens mental health. So the effect goes in both directions. But there's a lot that we can do. Getting rest, taking breaks, are all helpful things. And the older I get, the more I appreciate the Sabbath. And I think God planned the Sabbath as a 24-hour mini vacation. Doesn't mean we spend all of our time sleeping, because that's not healthy. Creating inadequate sleep during the week and then trying to catch up all on the weekend, that's what they call sleep debt. It doesn't really work very well. We don't really ever fully catch up. But I mean, what I'm saying is there's a lot of strategies, even within our 8 laws of health, that point, especially trust and divine power, that we can give our burdens to God and let them go, knowing that He cares for us, that we can seek first His kingdom, knowing that all the other things we need will be added on to us. We don't have to worry. We don't have to stress out. We don't have to panic about these things. So I think managing stress is an important strategy that helps us in so many ways. The one other thing I would argue would make the point is that we are a nation under stress, and our young people particularly The American Psychological Association does annual surveys on stress in America. And what they are finding in the more recent years, that the group in the US with the highest levels of stress are our young people. And that is our teens and persons in their teens and 20s. And the research finds that even the young people are more likely than older ones to find even the news as major sources of stress and major sources of emotional distress. And there's a lot of evidence, we can come back to that another time, of a lot more time spent on social media is also linked to depression and anxiety and even suicidal ideation and increased hospital ER visits for suicide. One study out of Germany found that 30 minutes on Facebook leads to worse people feeling a lot worse about themselves, because what do people post on Facebook? They post or Instagram, pick another one. What are they posting? They're posting just their successes. They're posting the great things that are happening. And you have a whole lot of friends, and it looks like everybody is out there having a wonderful time, and your life is boring. And so there was just even some news coverage this week of Facebook had documented this for some time, but hadn't reported it to the public, that for youth, spending a lot of time on social media is adversely impacting their mental health. So what I'm saying is there are lots of things that are making life more stressful, and it's even more important that we find ways to listen to our youth, to create relationships with them where they know that we care regardless, and that we want to understand and we want to help, as opposed to just jumping on them and criticizing them and putting them down. And our youth, I teach, been teaching for years, the teenagers at my church, and I have been so impressed by how insightful they are and how well they read us older folks. They say things that I had no idea they had a clue of, and they're so insightful and they see through us very easily. So we all are stressed, but I would say let's take time to get to know the names of the young people in our church and get to befriend them and show them that we care about them and show an interest in them. That is so important for their health and well-being.
I would like to also add to that, Dr. Williams, that you mentioned, of course, COVID this morning. You spoke a bit about the vaccine and so on. It seems as if a number of people, and you've probably heard of some of them, a number of pastors, a number of people in general have died recently, kind of unexpectedly, from heart attacks and so on. And you can't help but think about, and I've heard a number of people with recent cancer diagnoses and so on, what is the impact of the pandemic? This is probably something that will need to be researched, I suppose, down the line or sometime soon. But sort of secondary effects of the pandemic on people's health. Just like when the World Trade Center crumbled, so many people breathed that terrible asbestos and dust that came. They survived the actual fall of the Twin Towers, but many of them died of cancer within the first 7 years and so on. I wonder if the pandemic is having a similar effect on people's health, where although they may not be dying from COVID itself, that somehow because of the stress that we've all experienced over the last year and a half of simply having to live with this reality, if it's also becoming impactful on people's health and longevity in terms of, dying from other things that they may not have otherwise succumbed to. Any thoughts on that?
I would say a couple things. There have a number of church leaders that have died recently from COVID. So we have, I know of multiple examples in the U.S. and outside of the U.S. of church leaders who've died from COVID. In fact, in a couple of cases of persons who were opposed to taking a vaccine and have now died of COVID. I'm not going to give names, but there are a number of prominent examples of church leaders, Seventh-day Adventist church leaders, that has happened to recently. So one is the COVID deaths. I would say there are a couple other ways in which uh, the COVID pandemic is impacting us. And it's another reason why people need to get vaccinated. Because if we look across the United States today, over 90% of people in a hospital now with COVID is an unvaccinated person. And what's happening, especially in some states where there are hospitals are filled and burdened with COVID. There was a case on the news I heard of, I think this was in Louisiana, an ambulance with a man on board with a heart attack. And they're trying to get him to an emergency room so that he could get treatment for his heart attack. And every hospital they called within a 30-mile cannot take him because they don't have a bed. There isn't a place to bring him. Why? Because it's filled with people with COVID and who are unvaccinated. So one other strain that is being placed on the health system is when unvaccinated people now come down with severe COVID. If you are vaccinated, you will can still get COVID, but one of the good news is that it's much less likely to be severe, and you are much less likely to be hospitalized. So the overwhelming majority, I think nationally, it's over 90% of people hospitalized today in America with COVID is an unvaccinated person. So you are now using up precious resources. I heard from a friend of mine who had been diagnosed, a professional colleague, had been diagnosed with colorectal cancer and needed surgery. His doctor wanted him to have surgery immediately because when they diagnosed the problem, it was quite severe. Luckily, his situation worked out okay, but he had a multi-day delay in getting that surgery because of COVID. There was no place for him in the hospital, and this was in a large city in the United States. So one if impact of COVID, and that's why if we care not just for ourselves and our family, but for others more generally, the evidence is so clear that getting vaccinated is a good idea. And one of the things it does, it equips the healthcare system to better care for all the other needs in the community. One of the impacts of COVID is that I sit on the board of Loma Linda Health, Loma Linda University Health, which is the university, the medical center, and its affiliated hospitals. And of course, during COVID in San Bernardino, they were at the forefront of the challenge of COVID-19 in Riverside County and San Bernardino County. And all elective surgeries were not done for months at one point in the COVID pandemic. That means people who needed surgeries couldn't get them because the hospital is filled with COVID patients. So that's another impact, and that's another way in which there are effects. But there's another way in which there are effects. If we stop and think of the people who have had COVID, went to the hospital, came out alive, that group is not all well. They are using the term in the medical literature long COVID to refer to a range of conditions, some respiratory, some cardiovascular, that many of these individuals have, that have them disabled to a level where they are not able to go back to work and not able to function normally. So even the long COVID, I think the research is still fully trying to wrap its head around long COVID in terms of what all its determinants are. And it's a diverse set of consequences. But even if you survive hospitalization and you make it home, it doesn't mean that COVID is over. And there are long-term, debilitating, adverse impacts that is adversely impacting functioning. So there are a range of ways in which COVID is affecting us, and you're correct. I mean, the impact of COVID on financial well-being, especially for poor people and for Blacks and Latinos, is the data is very tragic. And yes, the government has done some things to help, but they are not sufficient for the depth of the economic and financial challenge that COVID has thrown many individuals into. So yes, COVID has a range of negative ripple effects, and there are studies as well that have looked at the mental health impact of COVID in terms of the increased stress and increased levels of suicidal ideation that are particularly high among persons who are caring for loved ones with COVID is one group that's high. Latino youth is another group that's particularly high on suicidal ideation as a result of COVID. So we are seeing a lot of negative mental health effects linked to COVID as well. So yes, a range of adverse impacts.
And there's one question in the chat about the 8 laws of health and building immunity for prevention of COVID. And you've touched on that a little bit, but I don't know whether
I touched on that a little bit. I certainly think COVID, which is a challenge to our immune system. The stronger our immune system, the better prepared we are to fight it. I believe we should do everything that we can to fight it. So it's a reminder. I think the things that we should do are things we should be doing anyhow in terms of diet, in terms of enhancing our immune system to fight COVID. I do not believe, as I have heard some Adventists say, that all I need to do is follow the 8 laws of health. And that even if I come down with COVID, all I need to do is to double down on the 8 laws of health. I think we need to, one, in addition to following the 8 laws of health, as I read this morning, Spirit of Prophecy is very clear. We need to use all the resources that God has provided to protect us and to prevent disease and to keep us healthy. All of them. So I got vaccinated as soon as I was eligible to get vaccinated, even as I am doing all of the preventive things that I should do to help me build my immune system. I want to have that extra insurance by doing all of the things that are available to us. So should we do them? Yes, but I don't think we should do them instead of. We should do them alongside taking care of all the other precautions and resources that God has provided to help us.
Dr. Williams, can you also comment on the role of discrimination and racism with like health and in particular in blood pressure? Is there any work showing that that could have an impact in high blood pressure?
I will give a brief answer to the question. Since probably in the world, I am probably best known for research on discrimination and health. I developed a scale that is now the most widely used scale to study discrimination and health, called the Everyday Discrimination Scale, that captures just the little indignities. One of my doctoral students just did her doctoral thesis by doing a meta-analysis of just trying to identify how many papers have been published. Over 450 papers published just using the Everyday Discrimination Scale. So everyday discrimination as just one marker of discrimination, because it's not the only scale out there, there are many other scales out there, is linked to virtually every adverse health condition you can imagine in these almost 500 papers that have linked it. So yes, it is linked to hypertension. It is linked to the incident diabetes, that is new cases of diabetes. It's linked to incident breast cancer. It's linked to multiple indicators of subclinical heart disease like heart rate variation, AFib, coronary artery calcification. It's linked to multiple indicators of inflammation, multiple indicators of inflammation. Allostatic load is a term used to capture biological dysregulation across multiple physiological systems, linked to allostatic load, linked to increased DSM-5 disorders, as well as increased emotional distress, linked to increased obesity, linked to poorer sleep quantity and quality, I could just go on and on. It's linked to such a broad range of adverse risk factors. So basically, what I would say, what we are finding is that discrimination is a type of stressful life experience similar to other types of stressors, because the kinds of things I just listed, all kinds of psychosocial stresses also predict those outcomes. But discrimination is disproportionately impacts disadvantaged, stigmatized populations. So if you look at data from Australia, it's the Aboriginal populations report higher levels of discrimination. I've done work not just in the US, but in South Africa. You find blacks and colors in South Africa report higher levels of discrimination than whites in South Africa, for example. That's the same is true in the UK and in other countries in Western Europe. So disadvantaged minority populations report a high amount. What we find, though, it's not just racial discrimination that matters, but regardless of why people are treated unfairly, whether it's because of their race or their age or their religion or their income level or their sexual orientation, or, I mean, it doesn't matter the reason or because of favoritism or anything else. The effects are similar. So, for example, the effects that we find that discrimination adversely affects African Americans, discrimination also adversely affects whites. Whites who report discrimination, we see similar patterns. Now, it's a lower proportion of whites that report discrimination compared to African Americans, but when we get a report of discrimination, the effects are similar across racial groups, and the source that someone attributes the discrimination to doesn't matter. It's the experience of being treated unfairly or badly that really has the negative effects. For me, it is a reminder that Jesus is saying to us, by this shall all men know that ye are my disciples, if ye have love one for another. He also said that a new commandment I give unto you, not just that you love one another. If he had said stop there, that would have been a tall order, that we need to love everybody, including people who are unlovely and not particularly lovable. Jesus is still calling us to love them, but he doesn't just tell us to love them. He says, a new commandment I give unto you, you love one another as I have loved you. So the same love that God has for us and takes us back even when we slip and fall repeatedly and we are rebellious and persistent in our rebellion, God takes us back and loves us. There's nothing we could do that would make God love us more, because he loves us with all of his heart. And there's nothing we could do that will make him love us less. He loves us. And he's saying that same kind of divine love, he wants to transform us to love each other in the church and outside the church with that same kind of love. And if we love people that way, if we see in each child of humanity someone made in the image of God that needs to be treated with dignity and respect, regardless of their attitude, regardless of what they said and what they did, it would be transformative. And that's what the world is waiting for, to see the character of Christ fully reproduced in his people. Christ's object lesson says, then Jesus will come. So taking the gospel message to the world is not giving the world the facts about the gospel. It's showing the world an example of people lives have been transformed by the power of the Holy Spirit, that we manifest the love of Jesus with everyone with whom we come in contact. That is God's call for us. That's what the church is all about.
Thank you.
Amen. Thank you. So if there aren't any other questions, thank you so much, Dr. Williams. Really appreciate it. I know you're incredibly busy, and I thank you for taking the time to spend this Sabbath with us. And Pastor Henry, I see you're on the line, so I'll let you close us out with prayer.
Yes, my expression of gratitude to Dr. Williams. Thank you for challenging us, of course, to do what we know, because, I mean, as a Seventh-day Adventist, of course, a number of things that you mentioned were taught to us. And I pray that we will be empowered by the Spirit, one by one, as you said, to do the things that we know, so that we can be in a healthier place and be able to share the good news to others also. So thank you very much for your time. Thank you for edifying us, and God's blessing upon you and your family.
Thank you.
Let's pray. Our Heavenly Father, thank you for loving us so much that you have taken the time through your servants to remind us of the things that we know and to inform us of the things that we do not know. I pray that you will give us honesty of heart and mind to reflect on our own lives and to take advantage of all, not only the knowledge, but the opportunities that you have placed before us to be healthier, so that we can be more available to you and to do your will and to share the blessings with others. May your Spirit write new messages in our hearts and empower us with greater power, so that we can live healthier lives, not only physically, but spiritually, emotionally, and in every other dimension of our lives. We give you thanks for blessing all of us through your servant today. In Jesus' precious name, amen and amen.
Amen.
Amen.